For this skill, we're going to do oral cares. For a patient who needs oral cares done, they always have it done in the morning and at night, and then according to care plan. Some people have it done after meals. For the patient, you do have to have them at a 90-degree angle, 75 to 90-degree angle, or high Fowler's position. With this skill also, you do want to make sure that you have gloves on, because you could come in contact with saliva or even blood sometimes if their gums bleed a little bit. You want to make sure you have all of your supplies handy before you start. So I have my over-the-bed table here. I have a basin that my patient can spit into. I have a toothbrush, a toothette, which is a sponge on a stick, which we can use to swab out residents' mouths who don't have a lot of teeth or have dentures and you do oral cares. I have toothpaste. I have a cup of water, and I also have a towel. You need to have a towel to put as a clothing protector on your patient, because you don't want them to spit and have anything go on their gown. So I'm going to place the clothing protector first on my patient. The next thing I'm going to do is I'm going to get my toothbrush, and I'm going to get my toothbrush wet by just dipping it in the cup. I'm going to put a small amount of toothpaste on here. I'm not going to put a whole bunch on here because that's just, you don't need a whole bunch to brush someone's teeth. All right, sir, you ready to brush your teeth? So when I do this, I'm going to tell him, I'm going to brush your teeth. I'm going to brush the outer surfaces of the teeth, the inner surfaces of the teeth, the chewing surfaces of the teeth, and lastly, I'm going to brush his tongue. You want to make sure for the headmaster test that you verbalize all of those steps. All right, open up for me. So first I'm going to do the outer surfaces of the teeth. And on top. All right, I'm going to move to the inner surfaces of the teeth. And then the chewing surfaces. And can you stick your tongue out a little bit? And the tongue. All right, hold on there for me. I'll give you a drink of water. Swish around. And spit. Would you like another drink? All right. And then I can use my towel. So go ahead and wipe off their face. And I have that done. For the toothette, just so you have demonstration of how you would use that, I have my toothette here, and again, it's just a sponge on a stick. I can have my cup of water, and I can go ahead and dip this in there. If you have a patient that's NPO, you want to make sure that you wring this out before you actually put it in their mouth. My patient's not NPO. So I'm going to go ahead, and I'm just going to clean the inside of his mouth with this sponge. Open up for me. So you can rub on the cheek surfaces, the gum surfaces, the tongue, all of those different areas. Sometimes for patients who do have teeth, sometimes they like to spit after this as well. So I'm just going to go ahead and give him the opportunity to do that. And then I would discard of all of my items, take off my gloves, and wash my hands. And that is the conclusion to this skill for oral cares.